I'm here with Ryan Stevens at the Somerset Medical Center, and in this video I just want to do a brief introduction so that you can all get to know him, see what his background is. Ryan, first of all, thank you very much for spending time with me. I really appreciate it. Why don't you tell our viewers at home what your background is, working with athletes and injuries and rehabilitation?
Oh, definitely. I'm happy to take part in this. I am a certified athletic trainer as well as a certified strength and conditioning specialist, and I work for Somerset Medical Center here at our Sports Performance and Rehabilitation Center in Bridgewater, New Jersey. And my capacity here, we have a number of programs that we provide to the community. My primary responsibility is I'm the athletic trainer at a local middle school, which is a rather large middle school. That never had an athletic trainer before, only the high school athletic trainers, which had to cover the middle school, which was off-site. So we developed that program, and out there I'm doing injury prevention, injury care, rehabilitation, emergency care, and planning for the athletes at that middle school. In addition to that, we have sports performance programs that we have here at the clinic that involve speed and agility training, conditioning, dynamic warm-up, teaching, and then strength training and balance training to improve their athleticism and address their deficits. And in conjunction with that, I'm also a certified functional movement screen specialist, where functional movement screen is a 7-step grading system. It's an assessment that looks at body movements and biomechanics to find flaws in movement mechanics that can lead to injury and lead to a higher risk of something breaking down. So that's one assessment we perform here as well. With athletes who come in, we will give them an assessment and then give them an individualized training session based on whatever the findings are of that screening. And in my background, outside of that, I've been a certified athletic trainer for 7 years now. After graduating from Penn State University with my athletic training degree, I've had the opportunity and the blessing to work with athletes at all levels, from middle school up until the professional ranks, where I was an intern with the Chicago Bears. I've got experience working with sports of all kinds as well, baseball, football, track, tennis, volleyball, basketball. You know, the whole scope. So I've been blessed to have a diverse background in not only injury care, but also I spent 4 years as a clinical athletic trainer in New York, where I really assisted and worked closely with the physical therapist for rehabilitation, and more so getting those sports injuries back onto the field with the focus on injury prevention, with programs that we did to supplement the rehab program.
Okay, great. With all that different types of experience that you have, do you have a certain area of sports medicine or rehab, or maybe a certain sport that's your favorite area to work within?
I really enjoy working with the injury prevention aspect,
okay,
because I feel there's a lot of crossover in that, whether I'm doing the sports performance program here or working with the athletes at the middle school. You know, I want to do what I can to make sure that I'm trying to decrease that patient, that client, or that student athlete's risk of injury. So, you know, when I take the approach of training someone, a lot of times I'm not just giving them a generic program. In sense, I am giving them something that's more individualized based on my assessment of the way their body's moving and where I see their weaknesses lie. Because if you just train what's strong and don't train what is weak and what's a deficit, the strong will get stronger, but the weak will just continue to linger, and that's going to set you up for injuries. So I have a really strong interest in biomechanical correction and exercise with the purpose of correction of any kind of deficits, flaws, or asymmetries, so that once they address those, then you can really take that athlete to the next level with their performance enhancement. And also, it keeps them on the field and healthier, with the research showing that when they don't have those issues going on, they're at a significantly less risk of having an injury occur that would lead to time loss from their sport.
So, one more question. Out of the recreational level athletes that you see, whether they're younger or, you know, our age or middle age or advanced age, what percentage of your typical recreational athlete that you work with has big areas of deficiency, like what you're talking about, that lead commonly to injury?
Quite honestly, I can probably only count on one hand the number of times that someone has come in to work with me with the goal of performance enhancement, that they haven't had a noticeable deficit somewhere that would make me want to step back and address that with some corrective exercises first before moving into the higher intensity performance enhancement type training. It happens it's a highly likely situation where someone's going to come in with that, whether it's a young middle school kid or someone who is 60 years old and is a master's athlete and avid tennis player on the weekends.
That's better, master's athlete. That's the
yes,
way.
the politically correct term. We see it all over, and a lot of times people don't realize they have these things going on.
Sure, yeah.
And that's why we do the functional movement screen, and we do these assessments as medical professionals, as exercise professionals, to find these weak links, to address them in a way that is going to help improve the long-term outcome of that person. And a lot of times people don't realize they have it going on because the body is great at compensating. If one thing is weak, something else will be stronger over time to make up for that. And because of that, people don't always realize they have things going on, and sometimes it's a big shock to them when I'm having them do certain tests that they find very challenging that they feel should be easy.
Right.
But because of their deficits that I'm isolating, they're showing up.
And you mentioned one area of the body, or maybe one muscle making up for a weaker one, and very often that's where injuries occur, isn't it? In those
Definitely.
weaker
When you have overcompensation occurring or weaknesses, that's definitely something that can lead to a higher risk of injury.
All right, well, I really look forward to doing some videos with you so that you can show us some tennis-specific areas for training and strengthening and rehabilitation. So again, thank you very much for spending time with me. I really appreciate it. Looking forward to it.
Thank you.